Women face many unique health issues from pregnancy complications, menopause to other risks like breasts and cervical cancer. Women also go through some health conditions that affect both men and women, like heart disease, diabetes, mental health, among other conditions. With all these health issues women face, there is need to be intentional with setting health goals. On Health Check tonight, we focus on what women need to do in order to improve their health for now and in the future. We are privileged to host Dr. Karen Muthembwa, an obstetrician and gynecologist who is passionate about women's health. Please tell us, sister, your friend, your fiancé, all ladies to tune into tonight's show. You can also share our Facebook and YouTube link with them because we are streaming this show live at Hope TV Kenya. Good evening and welcome to Health Check. My name is Grace Mutiso. Allow me to introduce Dr. Karen to us. Good evening, Dr. Karen.
Good evening, Grace. How are you?
I'm fine, thank you. And you?
I'm very well. I'm very happy to be here.
Yeah.
Yes.
You're passionate about women's health.
Right.
Tell me about that. When did that passion begin?
Wow. My passion began when I was a very, very young student at the University of Nairobi. And I realized that I love learning more about women and especially reproductive health. And I realized that it's easier for me to communicate with women. And I love the way women communicate. You know, communication is back and forth, not as compared to children and men. Not that they're not good people, but women tend to have very good communication skills. They'll tell you, and once they tell you what is wrong with them, they will explain further. And then, this is the catch. They take this information to other women, and they're the ones who give this information to their families.
Yes.
So women are basically the pillar of this every family unit, and the fact that I can be able to reach out to them, then it means I reach out to the rest of the world.
Yes.
Yes.
Yes. Interesting. And you know, every new year, all of us set goals. We set financial goals, we set weight goals, because it's a women's thing to do. Weight goals, I want to reduce kilos. I've rarely had a woman who says, I want to add. All of us want to reduce kilos. We set so many goals, educational goals and all that. I don't know if we set health goals. So my first question is it important to set health goals, especially for a woman?
Yes, definitely. The goals of health, especially for women, are very, very important because a woman is the one who creates a human being, and this human being should be healthy enough to also raise another human being. So as women, it's very important for us to keep ourselves healthy, and health incorporates a lot of other things, you know, not just body physical, it's mental, it's a lot of other things. So this woman who is healthy, they'll be able to maintain a healthy family if they have a family. And if they are able to take care of a healthy family, then you'll find like everyone around them becomes, you know, you can be able to spread this health to other people.
Yes.
So a woman is very important for them to keep and maintain their health for this particular purpose. Yes.
And let's talk about some of the health goals we can set as women as we come to this new year. It's a fresh start. You know, last year we said we want to reduce by 2 kgs. We added 6.
Yes.
We said I don't want to eat chocolates.
Yes.
We took whole bars of them.
Right.
So what are some of these goals we can set?
Okay. The main goal is to stay alive as long as possible.
Yes.
That is our main goal for everybody. But now when I break down to how do I stay healthy and alive for as long as I can, you know, it's things to do with keeping your body as active and as healthy as possible in a way that it is functioning at 100%. And how do we do this? You want to attain a level of fitness. You want to attain a level of cleanliness. You know, you also want to attain the best reproductive. If you are planning to be reproductive, you know, the next month, you know, you should be able to be as reproductive as possible. So there are different ways you can keep yourself that way. You also want to keep your mental health very well. So you want to attain the best emotional, let's say, the best emotional level that you can be able to. That means keep yourself as happy as possible, and of course exhibit the correct kind of moods, appropriate kind of moods depending on the situation. Okay, because it's also healthy to feel some level of sadness when the situation arises. Like if you lose someone, or if someone has to leave, or those things that happen in families and all that. So there's only a level of healthy really response to different situations. So our emotional health is also very important.
Yes.
Keeping away from pain is also a health goal. I talked about keeping fitness and all
Yes.
that. Pain also, keeping away from pain is also a health goal. Like, for example, those people who have menstrual pain, or they have conditions that keep them, as feeling pain throughout, and to other people it's supposed to be normal. Well, at least pain is not supposed to be normal, except when you're giving birth, which we should be experiencing some level of pain. Yes, and then of course other things like being able to keep your environment and people around you. It's up to you also to be able to enable them to feel as healthy as possible. So your relation with other people,
Yes.
your social skills, also that is also a goal that most people should keep. Things like being able to go to a doctor and attending for normal clinical reviews is also a health goal.
Able talk about that, because as women, we only purpose to come and see Dr. Karen.
Yes.
When I feel something is wrong.
Yes.
Can I just walk in if I'm okay and say I'm just here for a checkup?
Right, that
What's
is
the
why we
importance
do
of
what
that?
we do. It's, people need to go to the hospital, not because they're sick. The hospitals are there to maintain health as well, not just to treat, because there are several pillars. We do prevention, we do treatment, and also, of course, management of diseases that have to be managed over a long time.
Yes.
So people who are healthy, and especially us women, should be visiting a gynecologist regularly. A gynecologist should be like the baseline of what womanhood is
Yes.
about.
Yes.
So it's very important, because we do conversations around your health, how to manage your reproductive system, how to prepare for birth, how to also use things like contraceptives and all that. And then also we also do preventive services, like check for cancers.
Yes.
Like we examine for breast cancer, cervical cancer, and other reproductive area-related cancers. And if in case we find any other condition like blood pressure, diabetes, we work together with other doctors early enough so that we can be able to manage these conditions.
Yes.
Yes.
Okay.
Yes.
You mentioned something that I'm really interested in, that maybe many women watching us think it's not an important thing.
Yes.
Cleanliness.
Oh, wow.
Talk about that.
It's a very big goal.
How can you set that goal? What happens?
It's cleanliness is very, very important, because the more you're able, in fact, I'll put cleanliness and orderliness.
Yes.
Because as a woman, and as we grow up, I know most of us grew up in a setup where the woman was the one in the kitchen, so there was some level of cleanliness with being a woman, and it's also feminine. It's also
Yes,
very feminine
yes.
to keep things clean, to make sure that things are orderly, because all this cleanliness just prevents you from getting infections. Let's start from there. But at the same time, there's a mental aspect to this being clean that helps you as a woman to feel nice, to feel refreshed, to be able to think, to have clarity of mind, and that's very, very important. And as we talk about reproductive health, cleanliness down there is also one of the most important things that we also tell women to consider. But we see in the society, they take it to a notch, I don't know if I should say higher, where they use products and all this, which we don't necessarily need. So just water, we always talk about just, the down there is a self-cleaning organ,
Yes.
so it does not need to be cleaned thoroughly with soap and
Like the way you
antiseptic.
clean
Yes.
a sufuria.
Exactly.
No.
No need for that, There's just some level of cleanliness. We just needs water, and of course wearing the right sanitaries, and also having the right underwear, and cleaning the underwear the right way, So those things are the details that we need to, remember as women, that we need to wear clean underwear. We need to clean it every day. There are people who don't have the water to clean, so we encourage them, as much as we would like we consider everybody, it's good to have at least 5 underwears. At
Yes.
least.
Yes.
Yes, in the house, so that if you don't get to wash, you want to wash all of them at the same time. It's still okay, if you can't be able to get water every day to do that. But as long as you shower every day, you should be able to keep that area clean. So cleanliness basically is a very, very important thing, because if you don't keep clean, then there's a lot of odor-like smells, a lot of infections that can come in if you don't keep yourself clean. And again, I said, if you're a lady and you're taking care of a family, because that's usually our role in the society, is that if you're not able to do that, then the family will also not keep clean and healthy, and there'll be a lot of other issues because of just not keeping clean.
One more around that, you've mentioned also about putting on the right sanitary. We have so many in the market. Is there like a benchmark we can use and say this is the type? Yes, we know there are different companies, different.
Yes,
But
yes.
for you as a lady watching, this
Yeah.
is what you need to use.
Yes.
For the sake of your health down there.
Yeah, there are very many options in the market. We have the pads, we have the tampons, we also have things like the menstrual cup.
Yes.
At least most of the women who've used the menstrual cup tend to say it's actually better than all the others. Yeah, but the baseline is, let's talk about a pad.
Yes.
Because if we talk about everybody across the board has ever used a pad once in their lifetime. Different women have different preferences on the type of pad they're using, because you'll find someone not liking one because of the smell. Others have perfumes.
Yes.
And others don't. Others might not be absorbent very well as compared to what they're used to. So those are the things that would be the baseline of what you pick for yourself, because everyone is very individual. Some people get burns also by using pads,
Yes.
and particular pads over others. So there's no one particular one that fits all. But what I would say is to really look at the products that are in the pad itself, preferably things that are natural products, good absorbent, what are they called, non-toxic agents. You can have a look at what the write-ups on the pads.
Yes.
And then as you try the different ones, you will be able to know what works for you in your body. Then pads must be changed every 3 to 4 hours.
Yes.
Yes.
Why is that important, Dr. Karen?
Yes, because every time you produce, when you're wearing that pad, there's a lot of, blood, there's a warmth, there's, all that is just like an incubator
Yeah.
for different bacteria, different fungi to accumulate there. So you don't want to keep that for too long, up to even 6 or 8 hours. That stuff can really affect you. You've heard of things like toxic shock syndrome that can also occur just because of some bacteria that could be contained in, that area.
Yes.
So 3 to 4 hours would be very best. And of course, the cleanliness, the feeling that you have after changing, it feels better when you don't have an old pad
Yes.
in it.
Yes.
Yes. So that is a must. Even for tampons,
Yes.
the same thing. For tampons, it's better to use when you've already practiced, and it takes some time. Start with the mini ones, go to the regular, and then if you're heavy flow, you can use the super. It's possible to use tampons even if someone is a virgin. It does not mean that you'll break their virginity. Yeah, it's just the technique of putting it. Tampons are of different sizes from different companies. Also, the same thing. You must check what are the contents.
Content.
Yes, of that particular, and then do your research,
Yes.
and then pick what works for you. Yes, and menstrual cups are for the people who've used.
Yes.
They've been very, very positive about it. Preferably if you're not a virgin, because this one now is a bit bigger. But the level of protection gives you from spill is very high. It is easy to put it in, and also easy to remove. And then you don't have to keep buying sanitaries all the time. So this one, you just have it. When you're done with it, there's a way you clean it. Put it in hot water, boil it, There's different ways of treating it so
Yes.
that you can use it for the next time. So it's a very good thing for those ones who are not able to access a lot of or consistent sanitary pads or tampons.
Okay.
Yes.
Thank you. I'm hosting Dr. Karen Muthembwa, an obstetrician and gynecologist. You're talking about how to set your health goals as a lady. And thank you for joining us on Health Check this evening. And Dr. Karen, we have so many different health issues affecting women, and I'd love us to discuss a few of them, that stand out. Pregnancy and childbirth care.
Yes.
So what are some of the goals that a lady needs to set, especially those ones who are already in marriage?
Yes.
And you're looking forward to getting pregnant.
Right.
You're looking forward to taking care of this baby and all that and going through that journey. So what are
Yes.
some of the goals that you need to set before, during, and after?
Those are very important things to note. Most of our ladies, they come in when they're already pregnant, already showing. That's when they start their clinic.
Yes.
But I'm like, please, just come to the hospital before you get pregnant. So the main goal of pregnancy is to be able to firstly conceive.
Yes.
That's a one goal. It's a goal. And it is,
Yes.
sometimes it's work.
Yes.
It is a lot of work.
Yes.
First, to have conception and let me start from beginning. We have to be healthy first within yourself before you conceive, because the only way you can also conceive is if you're healthy. So if you're having other issues, then it may be a bit more difficult to conceive. So keeping your self healthy first before conception is one of those things. You must stop alcohol.
Yes.
Must
Yes.
stop alcohol. For those ones who take alcohol, must stop smoking. Should get into some level of activity. Should hydrate. Water, just water.
Yes.
A lot of water. Should be able to have a very good nutrition. Nutrition means you have all the carbohydrates, the vitamins, and the proteins in their rightful portions. Yes. So you have to mentally decide that you're going to eat healthier meals. Healthier meals is like, of course, you're avoiding the trans fats, like the fries and the chips and and these processed foods. Sorry to say, sausages are very and we
even
eat
those
them
ones.
even those processed meals are not necessarily the healthiest. They're food. Well, they've been accepted for us to eat, but it's better to eat more fruits and vegetables, which have antioxidants. They remove all those bad things in your body and get them out. Of course, with high fiber diet, because you want your gut health to also be very healthy. If you have acidity, it means your gut health has an issue.
Yes.
If you have things like gastritis, H. pylori, you've heard of H. pylori, H. pylori all the time, get that sorted out. Because in pregnancy, these things are exacerbated. So you feel there's more pain, there's more of this H. pylori, there's more of, all those issues. If you're diabetic and hypertensive, let us just deal with these things first before you conceive.
Yes.
Because that conception matters, how you start from the beginning. Yeah. So if there's any, even arthritis, those things happen in pregnancy. Heart disease. There's some people who have severe heart disease that we even tell them that if you get pregnant, then the chances of mortality are very high. So we really highly discourage particular heart diseases.
Yes.
Particular heart diseases. Not all of them. People with sickle cell disease. Also for them, they need to be managed early before we get into conception. So this is preconception completely.
So that means for a lady who is planning and trusting God for the gift of a baby,
Yes.
the first step is you need to sit down with your gyna.
Yes.
And go through critical questions. And
Very important. Even family history. Family history of conditions that can affect also like now you see we have things like sickle cell.
Yes.
Sickle cell is it's hereditary disease. And if we're able to, so we see these patients early, we see the chances of conceiving, of course, if you're sickle cell yourself, then if your partner is a non-sickle cell, they don't have a trait, then all your children will be most of them will be all of them will all of them will carriers of the sickle cell. So it's important for you to know what you will be getting into. Not that it's a bad, people live. In fact, these days they live longer. A long time, by 25, it was known to have very high mortalities. But now they're living longer, they're giving birth. We're having more pregnant women with sickle cell. So it's important to know so that we can be able to even manage this baby from as early as possible, because they can be affected. And especially if the partner is a carrier. So these kind of things, when we get family history, we're able to not really stop, but we're able to manage early enough to prevent complications.
Okay.
Yeah.
So that is before.
Before.
So we have come, we've gone, we've done the thing.
Exercised,
The Lord
you are
has done
taking
the
water,
necessary.
you're praying.
Yes.
Your mental health
Yes, is okay.
is okay
And
because
the Lord has answered.
yes.
Then what next?
Now you've agreed. In fact, we agree with you that yes, now we can go and try to not try, go and conceive. Just continue,
Yes.
Work on you.
At this point, is the spouse with them, or is just a lady alone with the gyna?
We encourage them to come with their partners.
Okay.
Yeah, at this point, we want them to come so that we can also check the husband.
Yes.
You see, now sometimes we need to ask these questions.
Yes.
So we tell them now, work on you. It's your kazi queen.
Yes.
So they go. And so we remove all forms of family planning because during this time when we are planning, we are using something to prevent pregnancy. So we tell them, go now. So we wait. So until when you conceive, in case they are above 35 years of age and they have not conceived within 6 months, we tell them to come back.
Yes.
But if they are younger than that, then we tell them to come back after 1 year if it does not happen, because even in a normal couple, sometimes they don't conceive the first month, the second month. It happens, even a full year, but the next year, 50% will have at least conceived. So until conception. So when conception happens, we don't wait until 20 weeks because 20 weeks is half the pregnancy. The pregnancy is starting to show. We just want to start with you early. And during the preconception, when we've told you to go, we've given you something called folic acid. The most important, even those ones who are pregnant right now and are watching, and you haven't started clinic, just get that folic acid.
What's the importance of folic acid, Dr. Karen?
It's one of the most important nutrients that most of us in our setup in Africa, there's some level of deficiency that we don't get, either because we're not eating well or our vegetables are not well, the nutrition is not very good. So that nutrient alone helps in the formation of the babies, particular parts of the baby, and especially the brain and the neural cord. You see the neural tube. It's called where the spinal cord is. There's a straight line that's called neural tube. You've had people having spina bifida.
Yes.
Such things, those the very, very important parts of this baby, the brain and the neural tube. Those two must be optimized. Folic acid is one of the causes of those things. So we must start them on folic acid before. And it also prevents other chromosomal issues. Chromosomes, DNA, the way they hold each other and all that. They need a lot of this folic acid.
Yes.
Yeah, so that's one thing that you must be on. And of course, if someone is diabetic, hypertensive, or other condition, we change some of the medication because some of them are not for pregnancy. We put them in pregnancy-safe medication, especially for hypertensives. Diabetics, most of them, if they're using the injection, it's still they continue with it. But if they are on some oral medication that is not good for the pregnancy, we convert and optimize first before we say go and conceive. So now when we conceive, just go to the doctor immediately. Say, now we are pregnant. I just tested pregnant positive. That's most of the time to be around 5 weeks, so that we can be able to review. Even sometimes we can recommend to do a fast scan. And why? Because we want to locate this pregnancy.
Yes.
Because sometimes some people have ectopic pregnancy. And most of the time if it's in the tube, it can rupture by 6 to 8 weeks. And that can be very devastating. It is one of the causes of death if it's not managed early. And you don't want, again, to have a pregnancy that can, if we can find it early, we can manage without necessarily doing surgery.
Yes.
Yes. So we want to locate. The purpose is to locate the pregnancies in the uterus and not anywhere else. Yes. And then once we locate that it's fine, we will, of course, put you on the we confirm that you're doing your folic acid. We talk to you about what should be expected in pregnancy. For example, at some point you'll have tetanus injection. If it's your first pregnancy, you'll have 2 shots.
Yes.
If it's your second one up to the 5th shot. And then, of course, if you have, we do tests, your blood group. Usually preconception, we already know.
Yes.
If you did come during preconception, we want to do HIV test because blood group can affect pregnancy.
Yes.
Rhesus negative can cause pregnancy losses if it's not managed early.
Yes.
Patients who also have HIV infection, this can also affect the pregnancy and even affect the mother. Syphilis. In the newspaper recently, there's an upsurge of syphilis in pregnancy.
Yeah.
And now I'm doing a research also, which the results will be coming out on chlamydia and gonorrhea, which surprisingly from my results, I'm seeing quite a number of chlamydia, and people don't know that they have it, you know. So some of these infectious diseases which affect pregnancy need to be treated early.
Okay.
Yeah. So all those things we do, we make sure, okay, fine, our tests are okay, even hepatitis and all that, they're okay, our HB is okay.
Yes.
Then we say, and our blood sugar is okay. We say, okay, fine, let's continue with the folic acid. Let's come for normal reviews. You'll have a review every month. Come with your partner. Let's talk about your birth plan from the beginning.
Yes.
As if we will never see you again. And if you're in a malaria place, we give you medication for malaria, just to prevent malaria infection in pregnancy.
Okay.
Yes. So afterwards, after delivery, I think we've talked about the before.
Yes.
During,
After
delivery, we must talk. Even before delivery, we talk about the after.
Yes.
The breastfeeding. How do you breastfeed, especially for a mother? It's not as easy as ABCD.
Yeah.
We think that it's, but it needs training so that this baby can latch well. We need to talk about how to keep that baby healthy, how to maintain your mental health, because there's maternal blues, there's a postpartum depression that can occur, which should not last a long time, you know. And sometimes people don't also get it. Most people get blues,
Yes.
just that blues, like, oh, am I not a good mother? You know.
Or even don't know it's the blues.
You don't
just
even know
wonder
that
what's
it's
happening
there.
to
And then
me.
people don't understand, you
Yeah.
know. They think that maybe you're being fussy because maybe you don't want the baby to be woken up.
Yeah.
At this time, they're like, you know, because it's for your mental health, you need the baby to be sleeping for this 1 hour. But
Yes.
someone is going to wake them up. So we should understand this kind of things.
Okay.
Yes.
Interesting. So it's important for a lady as a goal in the new year. Please see your gyna if you are
Yes.
planning to conceive. Before we go on a break, we can touch a bit about menopause, because we have women who've done everything they are done
Yes.
with the babies God has blessed them, and maybe we call them they're having an empty nest, and menopause sets in. Boom.
Yes. Hey.
So what goals can such women set?
Wow. There's a lot that goes on in menopause.
Yes.
A lot. You know, this is the time a lady has reached an age where you're like, you're elderly. And that word is not a nice thing. No woman wants to be told they're elderly. Or, and the partner is also going through their own midlife crisis.
Yes.
Sometimes you don't understand each other, so you're having relationship issues. The children are also leaving, they're going to university, they want nothing to do with you.
Yes.
Because they have their own lives to live, you know.
Yes, yes.
So the goals basically this time is, first of all, to keep your mental health in check. Because there's a lot of depression, anxiety, because now you're feeling changes in your body. And most so those ones who did not conceive. You know, it's easy to say that menopause is, you have already gotten your children, but we have those ones who didn't. For some reason, they
Yeah.
just didn't have children,
Yeah.
and now they're going into menopause. So they have to deal with menopause itself, and at the same time deal with the fact that they cannot be able to, according to the world standards.
Yeah.
I say that because I know God, even Sarah
Oh,
gave birth at
yeah.
97.
Yes,
You
yes,
know?
yes.
So these ladies are going through the most, you know. So mental health is, we want to keep it in check.
Yes.
So you want to keep yourself active. You want to be healthy as much as you can. Nutrition. You must check your nutrition. Again, the same thing. Actually, everybody, including babies,
Yes.
should be fed the right way from the beginning. I always talk about plant-based eating, and I believe that eating, you know, healthier plants and all that is very good. And lean meats. Yeah, if you want to do a Mediterranean kind of a diet. So your nutrition also determines how your body responds to some of the changes in your hormones in your body. Also, being able to keep active is very important. Physical exercise helps to keep your mental health, because at this point, there's a lot of mental and physical changes that are happening. The physical changes will be sorted out also by the nutrition and also the physical exercise. The hot flashes,
Yes.
those are the ones that really, really affect most people, and that's why most postmenopausal women will come back complaining of hot flash, because it's a very uncomfortable feeling. It's when you're just seated here with me, and then me, I start sweating. And you say, are you okay?
And it's too cold.
Yeah, it's going really freezing. Well, I'm sweating out, and it's visible.
Yeah.
And you can get angry very easily. So this is the time when most of them have. So people should understand also, and be just kind to these
Yes.
particular women. So the main goal is to, of course, make sure your mental health is in check. Talk to somebody,
Yes.
a psychologist, whoever makes you feel better about yourself. Take them. Because we have a lot of stigma when it comes to psychologists and psychiatrists.
Yes.
They're not there to make you look like a mad person. They're there to help you. They're there to listen. They're trained for that particular thing. Pastors, ministers, if you know you're a very prayerful person, and of course also believe in God,
Yes.
seek help from particular people in church, who might be able to help you through this journey, because some of them have also gone through it.
Yeah.
Yes.
I hear you. She's Dr. Karen Muthembwa, an obstetrician and gynecologist. You're talking about setting your health goals as a lady or as a woman right here on Health Check. It's a good point to pause and have a quick break. When we come back, we'll talk about the goals we can set when it comes to being screened for breast and cervical cancer. This is Health Check on Hope TV. Look and live. My name is Grace Mutiso. We'll be right back.
Hope TV has continuously provided you with life-inspiring Christian content. Our content offering is suitable for the whole family viewing, with Christian programs tailor-made for children, the youth, and adults, satisfying everyone's needs. We are glad to announce to you that Hope TV now broadcasts 24/7 on our website www.hopemediakenya.org, so you can catch all your favorite programs wherever you are. That's www.hopemediakenya.org to watch the Hope TV live stream. Hope TV, look and live.
Welcome back to Health Check right here at Top TV. Look and live. My name is Grace Mutiso, and today on Health Check we focus on setting health goals as ladies or as women. I hope you're taking notes and you're able to write what is your health goal for the new year, and how do you plan to carry it through, until the end. How do you plan to monitor it? That goal. Don't put 100, just put one. I don't know if I'm right, Dr. Karen. When we have our journals and we write 600 things we want to do.
Yes.
And we say, okay, we'll just focus on 5. But again, 5 inatushinda.
Yes.
Or we've done none.
Yeah.
So is it important to set as many as possible or just one?
You can decide. Different people usually manage different goals differently. But if you know that even those 5 are difficult, just do one, but break that one into 1, 2, 3. And then say it's only 3 things that will achieve that one goal. So it is fine to do that one, depending on how you see yourself.
Okay.
Yes.
Uwezo wako, your goal.
Najiangalia.
Sawa. Let's talk about how to set goals when it comes to screening. We know breast cancer, cervical cancer cases have been on the rise. So what goals can a lady set when it comes to these two?
In 2023, you must remember to set a goal to visit your doctor first. And as you're going to visit this doctor, you're going to set a goal that you're going to request to have a breast examination. And then you're going to also request for a cervical cancer examination. It's not, you don't have cancer, no, it's screening.
Yes.
Screening. That's the most important ones, especially when it comes to reproductive health. There are many other cancers, by the way, that we don't really talk about, but it's important for us to be able to check and see whether there's a likelihood that this person can develop that cancer. Things like vulval cancer. You've heard of that?
Which one is that?
The outsides. The outsides, they can also get cancer, especially if you've been getting things like HPV infections, like warts and all that. Some of these things are not even warts. You might assume it's a wart, but it is a cancer. So it's important to have a doctor. That's why the first goal is to visit your gyna. Everyone must visit a gyna, at least in January. If not January, February. We don't wait for Women's Month and Breast Cancer Month to remember to examine ourselves. So we also have other cancers that we screen for.
Yes.
So the cancers, it's cervical, breast, vulval. There's also ovarian. ovarian cancer, very quiet one.
Yeah.
It does not necessarily shout out until it's advanced.
Oh.
Yeah, and especially if you have family history, you see, now those family history are the ones we
Yes.
take.
Yes.
Family history of breast and ovarian cancer, those two, they go together.
Yes.
So if you have someone who in the family has ever had any of those two cancers, or even colon cancer, even a gentleman, or I mean a man in your family, you might want to check yourself as regularly as possible. If there's any change in your ovary, then we are able to manage it. If it's early stages, we're able to manage it earlier, and it can catch even young girls.
Yeah.
Young girls, I think the youngest I've ever seen is 15.
That's too young.
Yeah, I'm telling you, ovarian things.
Yeah.
And sometimes, it affects their fertility in the future because most of the time we remove these ovaries.
Yeah.
And they're very aggressive. So, ovarian cancer, don't look at your age and say, just get checked.
Yeah.
God gave us the ability to be able to help you.
Yeah.
So, those are the main cancers that we must remember that they exist, even vaginal.
Yes.
But now we also have things like STIs, screening. Especially if you're going to get a partner,
Yeah.
you've never been together, you're about to get married.
Yes.
It's important. It's important to be able to find out if everyone is okay. And if there's one with a problem, it's important for both of them to know and decide accordingly, because you don't want again to infect somebody with an incurable disease,
Yes. Yes.
and there are times you're able to manage these diseases to prevent infection to the partner.
Yeah.
So these screenings must happen, but more so cervical. Those are the number one killers:
Yeah.
breast cancer, and of course the STIs that don't kill, but they cause devastating complications. Yeah.
Okay. You talked about especially those who are planning to get married, and I know a goal for a lady watching us is this new year 2023.
Yes.
I'm becoming Mrs. Somebody.
Amen. Amen.
And if they are like some other people, I don't want to mention names, they only knew somebody called a gyna
Yes.
when they were about to get married.
All
When
right.
the best couple says, there is somebody called a gynecologist, you need to visit them. And they need to tell you a few things.
Yes.
Would you tell us the importance of visiting a gyna, especially for wives to be, or let's call them brides to be?
Yes.
Yeah. Where
Yes.
should they start?
They should just start. Just walk in. You don't need to think of a day, whether you're menstruating today. No. Just come, because we will discuss many things.
Yes.
We will, and especially for the things we've said, like for the investigations, for the STI screening. First of all, we will first check whether you've even had intercourse or not, because there are people who don't know, and it's true. There are people who don't know anything. So you find a couple, surprisingly, will come to you saying that they've not conceived, but they just didn't do it the right way. Because there are right ways of doing things.
Yeah.
So if we can discover, okay, so we are here, what is done? Some of them need that discussion. Then, of course, contraceptives. It's good to manage your fertility.
Yeah.
I know it's controversial in some places, but it's important to plan, because you need to space your children. Why is this important? Because if you keep getting babies following each other every year, it's not healthy for you as a mother. And you know why? Because all the time you're pregnant, something is taken from you.
Yeah.
Something physical, something emotional, something economical.
Yeah.
It's taken from you. You don't become you for yourself. It's you now for your many children.
Yeah.
And somewhat the partners are usually free to, they never show that they have children, even if it's 3 children. Every year they have a child. They don't show it. They don't show it.
But they just feel happy to be
They-
called Baba Nani.
Baba Nani and Baba, I'm the king of. But they live. When they walk out to work, they are just the same person.
Yes.
But as a woman, it's important to have the space in between for your own emotional, mental, physical health.
Yes.
And then also as you space, you're able to bond with this baby for those 2 to 3 years before you get another one, because there'll be a lot of sibling rivalry.
That
A
one.
lot of it.
Yes.
Yeah, and sometimes it can be so brutal. You didn't know that a child can really beat another child mercilessly.
Yeah.
So give them time. Even those 3-year-olds feel like, it's too much. You brought another one. Let me pull their face out, you
Yeah.
know. So that spacing is important. It's important for your economic growth,
Yes.
because these children, as they're going to school, they need to, so these are the discussions we have, because as they're going to school, every year you will be having another and getting to university, and you'll not be able to manage the cost of living for these particular children. So we discuss children, we discuss what is expected in pregnancy, together with the partner.
Yes.
Actually, we discuss things like growing together, about their relation, what to expect. Sometimes we become counselors. We discuss these issues that, because of different things about their sexuality and also their reproductive health. The man might have the problem even, they also experience dysfunction.
Yeah.
They also experience mental health issues, especially when a baby comes in. So we should tell them what to expect. This time, mom is going to I don't know what you call her, babe now.
Babe.
Is going to be busy with her own baby.
Yes.
And she'll not give you attention the way you expect it to. So he should expect that, so that he doesn't also get postpartum. Now they also have postpartum depression. So we discuss all that as a whole, as they're planning to get married. And then during their wedding, sometimes they have issues with menstruation. It's like you don't want your periods to come during your wedding day. So we plan, even the date can be planned from your calculations.
Yes.
We see which day you'll be free of your period, and then we tell you. And then we tell you, you might even be fertile on this day. So they are aware that if you're going to start this day on your wedding day, you might get pregnant. So those are the discussions that we go about. So don't shy away to come.
Visit.
Yes.
Visit Daktari.
Yeah.
We have mentioned about this lady who is ready to get into marriage, what the goals they can set and how to prepare. We've mentioned about the lady who is already in marriage, menopause calling. What about a lady,
Yes.
a mom? You
Yeah.
have a teenage daughter or you have daughters.
Yes.
What health goals can we help them set or
Yes.
set for them?
Right. So our main goal is to grow up as healthily as possible and have the normal body changes as they should.
Yeah.
That's our main goal. So the thing is, with a teenager, we also expect the parents to have conversations with them before they even get to us. Because before they'll be asked, they'll ask, where do I need to see a gynecologist? But it seems like also our parents didn't see a gynecologist in their teenagehood. So it's good to have that conversation with your teenager, especially things to do with reproductive health, menstruation, and even sex. Because they're growing up, they know things that we don't think we even knew when we were at that age. And sometimes we don't even know them even at this age. So just be bold and ask them what they know first. What they know first about reproductive, menstruation, sex. It might be a bit uncomfortable. I mean, if it's very uncomfortable for you as a parent, then get her to see us or him to see us. Even the boys need some level of talking,
Yes.
because they still take part in some of the complications of the decisions that they make.
Yes.
Yeah, so the discussion is done first. Then you decide, no, because we've talked about these things, let's go and reinforce it by discussing it with a specialist doctor who deals with our reproductive health. This I'm talking if it's a mother talking to a daughter, an auntie talking to a niece, or a lady who wants to teach young girls to grow up the right way.
Yeah.
So see our gynecologist. Now we come in where our goals are to teach about reproductive health. We're talking about things like pregnancy, that it's possible to get pregnant at that age. If this happens, the things that come with pregnancy, and asking them, are you really ready for this? The mental health aspect, the economic, do you have money to take care of yourself first, to take care of a baby, So we talk about that in detail. And then we also talk about the sexual act. Is this ready? Are you ready for this? Are you ready for emotional? They go through breakups.
Yeah.
They do.
Yeah.
It's not just people who go through divorce, go through breakups. These young children are going through their own little emotional turmoil, Are you ready mentally to be managing a relationship like this, especially when you're doing your, no, it's not from 4 exam or end of year exam. Are you ready for this? Saying no, I don't think. Or maybe they don't know the intensity of what emotional turmoil that can go through a breakup,
Yeah.
So those things and the decision to have sex, when is the right time? Because it was ordained by God, but when in a setup of a marriage, So those are the goals that we need to talk about: reproductive, sexual health.
Yeah.
Yes.
Okay. And you need to saying that, Dr. Karen, we don't want parents flooding your office with their children. Hey, tell this one about this sex thing, no
Right.
intimacy thing.
Yes.
So what role do they have? Do they need
Yes.
to do something at home? Ikishindikana is when they raise them to with the gyna or straight to the gyna, please.
I think for us, we just go to reinforce the
Yeah.
information, but the information comes from within the family unit. If you are from, if you know that your family is, okay, because there are children who come from very broken families. If you are in a generally, and you're a parent or a guardian, let's say you're even a man, and you're the one taking care of your children, you don't have your wife there, maybe because she's not there, she's passed on or whatever, then it's important for you as a man, you still step up because you're the parent.
Yeah.
You've grown. This child has asked you for pads at some point.
Yes.
It means she knows things. She's not afraid to, because she needs to ask you. There's nobody else to ask.
True.
And you also have to buy this pad for her.
Yeah.
So this is the right time. When you're talking about these pads, ask her. You don't have to say, let's talk about this. Just ask her, how is your it might be a bit uncomfortable, but depending on your relationship with your child, you can ask her, how is this experience? Is there anything else you'd like me to help you with? How is school? How is your relationship with friends? Is there anybody I should know about? Just know what your child knows. Ask them what they know, then reinforce it. You don't have to go bash. There's no child who will talk about sex with their parent direct. They'll be like, no.
Yeah.
Don't give me this, And if you feel very uncomfortable, have that. Let someone who's a lady, if it's a girl, or a gentleman, if it's a boy, to come in and have that conversation. It might be a bit easier for them, depending on your relationship with your child. But if you have a not very good relationship with your child, and it happens, because sometimes we think it's a parent's fault. No, it's not the parent's fault. Maybe it's nobody's fault. Everybody has difficulties, as to why they are not relating very well with. But these are the things we pray about every day, for God to restore this kind of relationships. But in that case, we start from the beginning. But it all starts from the family unit. How you know how to deal with your wife is how they will deal with their partners when they grow up, not how they've not seen this side of us, the doctors, how we deal with the opposite sex. They only know information. So we're only one way like this. But they see it how you relate with your partner at home. They see how the auntie and uncle relate. And that's if you beat your wife, your son might most of them pick up the same characteristics, unfortunately. Or the girls might pick up like, I should be timid and allow this to happen, and it's okay for someone to beat me when I'm in my family unit. So if it's in that situation, sometimes someone else can stand in, and then if a child can see that this is not good for them, we have services for youth. We do have services for youth which are free, especially at my hospital in Kenyatta, where you just walk in, as long as you're under 24 years of age. Walk in, you will have a mental health person, a psychologist if you wish. So if you feel like you just want to talk to someone, just walk in. They will book you a date and then make sure the psychologist is there. If you have an issue with your gynecology, they also call us in to go and see you for free. For free.
24 and below.
24 and below.
Okay.
Yes.
It's our Kenyatta Hospital.
Kenyatta Hospital, yes.
Okay. Thank you, Dr. Karen. Before we say our goodbyes, I wanted us also to talk about mental health in women. Very big. A big topic. A lot happening. So what goals can women set in regards to their mental health?
Okay. Very, very important. In this situation, in this country, and in the current economic situation in everywhere in the world, and social media, and all this, there's a lot, so much pressure on different things, So our goal is to maintain the the appropriate mental response to the situations around us.
Yeah.
Okay, so our goal in this case is to keep as happy as possible. Okay, appropriately happy. You know, there's that one that is all over the place. You know,
Yeah.
there's I mean, happiness is. I don't think we can quantify it, but you need to be in up mood. You know, energized. You know, high feelings, high energies. You know, so how do we do this? Exercise, water, simple water. Just take water; it calms you down. For a moment, it does give you that calming effect. You know, it's like the way you see a river flowing or the ocean. It always has a calming effect. Thank God for water.
Yeah.
You know,
Yeah.
so you want to keep. The only way you can also keep your mental health on check is your nutrition, physical exercise, talking to yourself, meditation, prayer.
Yes.
If you can be able to pray and meditate upon the word, it's even in the Bible.
Yes.
You know, it is not
yes.
a new thing. Meditation is not a new thing. It's been there and it's recommended. Pray, you know, pray. Have reference for God, you know. That really helps a lot of people, you know, transfer the stresses and the burdens and all those things, you know, to a higher being. And that's very important. And then, of course, having the right relations around you. Say no to negativity, you know.
Yes.
You don't need friends that keep telling you you're fat.
Mm-hmm.
You're not beautiful. Someone tells you, you have a scratch on the face. What happened? You know, like you already know you have the scratch on the face.
Yes.
I don't think you want to have someone emphasizing, you know,
no.
that eye is not looking nice or that hair is, you know. Of course, it's positive, good vibes that can come from your friends. Like, let's go and make our hair. You know, it's different from you say your hair looks bad.
Yes. True.
Yeah, or let's go and sit somewhere and because sometimes you need these friends. Women, we are very good friends. We thank God.
Yes.
We have very good friends who say, you know what? Let's go out of this house. No feeling down anymore.
Yes.
No, relationships that also affect you, especially those ones in dating relationships where there's a lot of Nairobi happening. Some of these things you can cut them off.
Yes.
And it's okay to do so.
Yes.
It's hurtful, it's hard, but for your own mental health, you don't want to be in a place where you're dying slowly. People are walking dead. They are walking, you're alive, but you're dead because of somebody else. Doesn't make sense, does it?
No.
You just all you need is God and yourself.
Yes.
And if you have children and your children, but somebody else, I don't suggest that people should leave each other. But in dating relationships where you can already see there's red flags,
Because
those are
that's affecting mental health of many women.
Yes, many. Even people in church, even people who are believing, and it's affecting. So we should not allow anybody, any other thing that is not within yourself, to affect you. Just leave it to God, and just you are more important. Love yourself first before you can be able to love others. But if you hate somebody next to you, then a hurtful person is going to hurt anybody else.
Yes,
You're going to hurt you're going to hurt your children.
Yeah.
You're going to hurt other people. So you need to be okay. Your mental health really matters. And you as a woman in the house with a husband and children should be able to because we hold a lot at home,
Yes.
Some husbands also rely on their wives' feelings to be okay.
Yeah. Yeah.
So if you're the one down like this, sometimes your partner is also down. You now go down together.
Yes.
So
Yeah.
we need to maintain all this, because you also have to. Most of the time, we have to show a brave face.
Yes.
Even if things are not going on well. Yeah, and talk to somebody.
Okay.
There's nothing wrong with talking to somebody.
Okay.
Yes.
Wow. Thank you. And mental health is key as a goal because it affects every aspect of your life.
Even physicality.
Yes.
Even how some diseases manifest because of your mental health.
Okay. Yeah.
Things like high blood pressure. Everybody knows it comes from some level of anxiety and consistent chronic depression or consistent chronic problems around you.
Okay.
That's how it shoots up, or diabetes. So we need to, the mind is a very powerful thing. Yeah.
And if a woman is watching us, a lady is watching us and has a mental health issue that is messing them
Yeah.
up, where can they get help, Dr. Karen?
They need to get to, there are different places for psychological help. You don't need to go to a psychiatrist immediately. You can start with, even, first of all, they're counselors.
Yes.
Let me start
yes,
from there, yeah.
yes.
There are several counselors in different places. I don't know if they want me to mention the places. Or, okay, but you can even reach out to me. I have a group, a foundation I'm creating where I'll be allowing people to also reach out and get direction on where to go, even if it's not necessarily towards me as a gynecologist. So where we can be able to direct people to particular people. So counselors, psychologists. My group, the under 21, has
Yes.
counselors, psychologists. You know,
yes.
maybe I'll create one for women where you
Yes.
can access different doctors. In different capacities, yeah, and then psychologists is also important. They treat without writing medication, where they treat like where we are talking. We're
Yes.
seated and I listen and you talk to me. Just talk to me,
Yes.
and then I direct your thoughts, because your thoughts determine your actions.
Yes.
And actions your behavior, your eventual behavior, and characteristic and character as a person. So they can be able to help you change your thoughts.
Okay.
And I think it's one of the most, even if you're okay,
Yes.
sometimes you want to improve something about your life. A life coach
Yes.
can really, really help, because they also help with your thoughts.
Yes.
They help you think in a different perspective of life, so that you're not consistently thinking the way you think is right.
True.
They give you another perspective of making it financially, psychologically, in any. These are life coaches. They're very, very good. Don't take them for granted.
I hear you.
Yes.
You can repeat that again. Thank you, Dr. Karen. Our
Welcome.
producer and director are telling us time is up. We have to call it a day. I want to give you a minute for those who want to get in touch with you. How can they do that? As you also give us your parting shot.
Okay. Maybe I should start with the parting shot.
Yes.
That all women are beautiful. Women are amazing. I love women. I do love, like I love me. I love being a woman, and taking up our femininity is one of the most important things, because there are benefits to being feminine. If I walk here and I fall, someone will carry me because I'm a lady. If it's a gentleman, carry yourself,
Yes.
So those are the things. We should embrace ourselves
Yes.
and love ourselves. If you want to change something in yourself, first love yourself the way you are.
Yes.
If you feel like you're too big or too small or too chubby or, different things, love yourself. And then change those things slowly.
Okay.
Yes, where you can find me, I'm usually at IPS building, Kimathi Street, first floor, Dr. Kinuthia's office. As for Dr. Karen, and my telephone number is on my Instagram at K Muthembwa. That's my office line.
Yes.
And there's an email address there that you can also email me.
Okay.
And I also do talks as well
Yes.
these days.
On Instagram.
Yes, on Instagram.
Okay.
Yes.
Thank you. Thank you, Dr. Karen. God bless you and have
Thank
a beautiful
you.
new year.
Yes.
We look forward to more and more sessions.
Yes, me too.
Okay.
Thank you.
She's called Dr. Karen Muthembwa, an obstetrician and gynecologist, helping us know how to set health goals as women. And you know what? As she said, you need to love you. You love you first. Then it will be easy to project that love to someone else. Two, just set one goal, just one. Let's challenge ourselves on health check as every lady watching, just one goal. And let's follow it throughout this new year. Have a beautiful time. My name is Grace Mutiso. It's always a joy and honor to serve with you. May the Lord bless you and keep it right here at Hop TV. Look and live. This is Health Check.